Wow, look, that seagull is standing on that sculpture. Who is he?
Interesting. I actually have no idea.
What? You've been here for 1 year. How can you ignore such a large sculpture?
Haha, actually, many people make that mistake. Only the pigeons and seagulls would stay by my side. They are not friends, they just use me as a loo. Have you seen the plastic spikes on my head? The council use them to deter birds from me. They want me to look strong and proud, not covered in bird poo. But in that way, I feel even more lonely. I mean, I know it's a great honour to stand here, but sometimes I just want some friends to talk to.
Oh my god, you can talk!
Sure, everything on this street is alive. You just have to be here at the right time.
Unbelievable. Who are you?
Me, I'm an Aaron Bevan. Just an ordinary Welshman who founded the National Health Service.
But why are you here? Why not outside of a hospital?
That's a very good question. You're more observant than many historians. Thanks to Robert Thomas, who's best known for working in bronze sculptures, I am lucky to be one of his works. I devoted my whole life to ensure social justice, the rights of working people, and democratic socialism. So it's really nice to be here and see my people walking around, chatting freely with a happy smile and a healthy body.
So, you're from the upper class?
No, actually I was born in a mining family in Tredegar and became a miner myself on leaving school at the age of 13. I don't regret my choice at all, and through my efforts I was elected a Member of Parliament for the seat of Ebbw in 1929. After Labour's landslide victory in 1945, I was appointed Minister of Health.
That sounds cool. It sounds like your life has been going really well.
To be honest, not quite. I also encountered some unpleasant things in my life. For example, I put forward the national insurance system. This plan was opposed by many doctors, but through perseverance the NHS was finally launched in 1948. Speaking of which, I'm quite curious about how people are talking about my achievements and failures. Can you help me find that out?
Sure. Vicky, why don't you call the experts at Cardiff University and find the answers?
Sure, let's go.
Well, this is Dr. Ali Jones from the School of Healthcare Sciences at Cardiff University. Hi, Dr. Ali Jones. We want to ask you some questions about the NHS. So,
in terms of the
what
National
kind of
Health Service
achievements has the
specifically,
NHS made?
One of the major achievements, so when I go and do research internationally and just travel and talk to people, the National Health Service still has a major achievement in terms that it delivers healthcare which is largely free. It's paid for through general taxation, so we all pay for it in a way, but we aren't asked to pay at the point of receiving care. We receive care free of charge, and in a way that creates problems as well as opportunities. So it's a real benefit, it's a real advantage. We don't ask people how much money they've got and whether they can afford treatment. We just treat everybody more or less the same. The health outcomes the NHS achieve are some of the best in the world. So research by the Commonwealth Fund, for example, has shown that when you look at how much we spend per capita on health in the UK, and we look at NHS outcomes, they're consistently in the top three, if not the overall. Last year, the UK NHS was regarded to be the most efficient and safe system in the world, based on the overall. There are other systems that are safer about certain things, for example, but when you take the overall, the population, and how much we pay for it, the outcomes we get are excellent.
That's great to know, but I read some articles before where some people are complaining that they have to wait for a long time. Do you agree?
Well, the waiting lists are increasing, or routine surgery, things like hip replacements, knee replacements, that's for sure. So it's like I said a few minutes ago, the acute part of the care, where you need to save people, rescue people very urgently, pretty good. But if you've got a long-term condition, then the waiting lists are increasing. And that's obviously problematic for those people. But the NHS is in a period of transition at the moment. The NHS is saying to people as well, which is a bit controversial for some people, is that we won't operate on you necessarily straight away if you have a hip condition or a knee condition. You should try and get yourself better first. I think try and get people to be more active, losing weight. All of these things would improve the outcomes anyway. What we know with knee surgery, for example, people who have knee pain, they're often in, because of the knee pain often, but sometimes we're not sure what comes first, but they're often not in not very good physical condition. And if they actually looked after themselves a bit better, if they ate better, if they exercised moderately, then the need for surgery may well disappear. There's some pretty good research that shows that. So it is a bit controversial. The message is now changing. So when the NHS started 75 years or so ago, it was kind of, we treat everybody, bring us you're sick and you're old, and we will treat them and we will look after them. But now the message is kind of changing to say, we've got 65 million people living in this small island and taxation kind of covers most of this. But if we carry on the way we're going now, where the public isn't looking after their own health, we won't be able to cover everything. So things like routine surgical interventions, like hips and knees, but also things like lifestyle behaviour, smoking, diet, lack of activity, is crippling the NHS at the moment. When you look at rate of diabetes, when you look at rate of mental health as well, because people aren't necessarily sleeping well, they're drinking too much alcohol, possibly. All of these things impact on mental health.
So, in your opinion, how can the NHS be improved?
So the message going out there now is for people to try and look after themselves a little bit more. Don't just rely on the National Health Service to save you. Try and avoid getting into that position in the first place. And that's seen as controversial because people have been brought up in the UK to expect the National Health Service to be there for them, whatever. Not to be judgmental, not to say you're a smoker, therefore we're not going to. But we are saying that in the National Health Service now. We're saying to people, you have to give up smoking before we operate. You have to lose weight before you operate, because they're really outcomes are really, really poor for those people if they don't do those things. And in a way, it's a waste of money. It's not a very popular thing to say, but because people say you should, I have paid into the system, but we don't pay enough to guarantee infinite amount of care. We pay enough just about to keep the National Health Service above where it needs to be, but if everybody did nothing about their own health and expected fantastic services, then it's not going to happen, I'm afraid, unless we pay more or unless people look after themselves. So some of the research we do in patient safety is looking at how many nurses are required in hospital care to look after certain patients. It looks on the surface like it's a fairly straightforward issue. Nurses look after patients, but nursing and nurses is the most expensive part of the National Health Service. They're the biggest workforce group. Therefore, we need a better idea of how best to deploy the right nurses to the right patients. It's not all about cost, but it's also about quality and safety. So which nurses would give the better quality care to the patients at various points of the patient's journey.
Thank you so much. We've got our answers, and now we can share these with Mr. Bevan. He's really looking forward to hearing these.